I've heard in the MMC's response that she says that she also spoke to boys. But what is problematic about her remarks is that we all know from the statistics around the spread of HIV that normally girls between the ages of 15 to 19 are not impregnated by their peers. So even if the MMC spoke to boys at that school, the likelihood that it is older men who are probably not in schools who are impregnating these teenagers is larger than not. But we also know that what has been very unique or worrying about the recent pregnancy statistics is not an issue of teenage pregnancy. And I think teenage pregnancy masks the reality of what is happening. What we are seeing is statutory rape, and what we are seeing is child abuse. And all of those factors are not in the control of the girls. They are not often in the control of those girls as they are negotiating safe sex. In a study, the Kwanele study that was done in Khayelitsha, for an example, a number of young people and children, even at primary level, were being sexually abused by caretakers, by people in the community, and by teachers themselves. And I think for me, you normalize the fact that whenever a girl is pregnant, we blame the girl, we blame the girl's behavior, and we therefore make it normal, as if when a girl is pregnant, they basically asked for it, and therefore they do not deserve the kind of care and thought that as a society we must basically give, and ask ourselves very difficult questions of what is happening in our communities for these girls to be impregnated by often, as I said, people who are older than them.
Well, Lebo, I think you've touched on a very salient point in this regard, and just so that we, can connect to what you're saying, I'd like to play a quick clip with regards to what you've just contextualized for us. Let's take a listen.
Slogans has made South Africans to start realizing that teenage pregnancy must be given the very same priority that we were giving to COVID-19. All of us, when COVID-19 hit us, it became a national crisis. It became an international pandemic because it was hitting on the heads of states. Captains of industry were dying of it. So because teenage pregnancy is affecting the poor and the working class, that's why it's not making a given priority. So if this slogan was able to make sure that everybody start talking about teenage pregnancy, we're in a war, we're in a crisis. We need to deal with teenage pregnancy, and all of us must work together. Those who are critical, I'm welcoming them to come and sit on the table with me so that we can share with them.
Well, Lebo, you heard the MEC there, defending her argument and saying that really, in using the slogan, girls, close your legs, open your book, she's in fact kind of made it an issue that is talkable, really, and made it a part of the national discourse. But at the same time, making your earlier point, going back to your earlier point about how counterintuitive her commentary may have been at the same time, given the fact that we know that departments such as the Department of Basic Education is currently gazetting policies trying to stem the tide of teenage pregnancy. How do we make sense of the two positions that have been put before us?
Well, I'm smiling because I want to hope that the MMC is a lot more sophisticated and able than thinking that saying to girls, close your legs and open your books is going to change anything, quite honestly. And if we are just talking about messaging, there are a few critical things that the MEC must consider. Is that what we know right now, out of many, many years of research, is that young people want engagement and not talked to, number one. Number two is that in messaging there is something that is called victim blaming. It's when you take a problem as complex as teenage pregnancy, where the levers of control, particularly when you have the kind of power that the MEC is having, is often outside of the hands of young people. And then you victim blame. You say to the person who is likely to fall pregnant, the pregnancy is yours. What happens to a young woman who is probably being abused, who are standing there at assembly? What happens to the stigma that young girls receive when they are pregnant? What happens to the behavior of older men who know that somebody in her power and in her position is actually not questioning the men, is not questioning the teachers, is not questioning the men in the community, but is questioning the girls? So quite honestly, with all due respect to the MMC, I think it's a joke to even defend it. I think, in fact, what the MMC should have done is to say, here is an opportunity for us as people in leadership to learn about how do you message to young people, how do you deal with young people, and what research is telling us. The Department of Health is sitting with a whole lot of research that they themselves, organizations like UN, organizations that have been supported by Global Fund, UNAIDS, and other agencies, have about what are the drivers of pregnancy amongst young people. And I want to repeat, even the name teenage pregnancy is diluting an issue of child abuse and statutory rape in our communities. The rape statistics are that of young children, even younger than 14, 10 to 14. The fact that in our communities and in our schools, we are seeing children as young as 10 years present full term for a pregnancy means that the system itself is failing. So when you are in a position of power, like an MMC, your role is to then say, what are the environmental factors that are causing girls to fall pregnant? Now, for an example, if they were implementing a very robust, comprehensive sexuality education in schools, if the very schools were able to have social workers who will determine what is happening in the homes of these young girls, what is driving them, even if they are going for weaves and they are going for whatever she accused them to going for, what are the drivers? We must expect from our leadership a lot more sophistication, because they are the ones that must drive policy. Now, somebody who is going to be sitting on one way, basically saying it is the fault of the girls, sitting with a department that is basically saying report these cases because they are statutory rape. They are not speaking the same language, and that is why in South Africa we end up having good policies, but we don't have good implementation, because the attitude of those that must implement the policies is represented by the MMC that says, well, girls are falling pregnant because they are opening their girls. Let us as South Africans understand one thing. Young people will have sex, but they must have sex and be able to delay sex. And they must be able. And for someone to be able to delay sex, it's because the environment is futile. Talking down to them is not making the environment futile. I would have, in fact, preferred that the MEC, if they are so concerned about teenage pregnancy, invite organizations that are experts in this work and say, how do we support our young women and girls? And how do we understand? And maybe have a focus group where the young people themselves are talking to them. When you make messages like the MMC, you are even stifling young people to tell you what are some of the drivers, because you come in there with a finger and then you point at them. It's nonsensical and it's not effective. We've known, I started my work 30 years ago in the field of communication for behavior change. And we know right now, and we should know right now as a country, that the messages like the MMCs are ineffective. In fact, what they do is the opposite. They drive silence amongst young people. Young people do not want to talk. It's like when I was growing up 50 years ago, 40 years ago, when I started menstruating, and I was told, don't play with boys, without unpacking what does that mean. We need to stop speaking in euphemisms. We need to follow methodologies that work. We need to engage young people. And we need to be sophisticated and nuanced in saying what is causing young people. This is almost like, I want to trend. I want to be in the news. I want to say a statement. It's careless. It's unfortunate. And it undermines a lot of efforts that have been done to fight sexual abuse and statutory rapes, and to fight what young women are facing that is causing them to not only fall pregnant, but also suffer from or contract HIV 4 times more likely than their male counterparts.